We talked about overall the use of adoptive T-cell therapy for treatment of post-transplant lymphoproliferative disease that's EBV-driven. And the idea there is you're just trying to use T-cells from people who have good immunologic control of EBV to treat EBV LPD or lymphoproliferative disease in people who don't have that immunologic control. And so the history of this really started 30 years ago, using initially bulk T-cells from hematopoietic transplant donors into their recipients. And now we're in a place where there's a Phase III registrational ongoing trial, the ALLELE trial. And we recently published initial results from that trial involving 43 patients. And those 43 patients have a response rate of 51%. 28% of them had complete responses and 23 had partial responses. And in this treatment setting, partial responses have been durable, which is very different from how we think of partial responses in the setting of chemotherapy treatment. And in terms of the tolerability of the therapy, the adverse events have been manageable. So while 23 of these patients had treatment-emergent adverse events, only 4 of the recipients had treatment-emergent adverse events that were related to therapy, and none of the fatal events in this very high-risk patient population were related to therapy. So that's sort of the update we have, the published 43 patients. The trial is continuing to accrue, so the EMA licensing and approval included the commitment for continued data submission to the EMA. And so the trial's ongoing with the ongoing real-world data collection as well.